Hello, this is a virtual microscopy slide of a case of invasive urothelial carcinoma of the bladder. Just for quick orientation, this is the mucosal edge, and this is where the lumen of the bladder will be, and this is going deeper into the wall of the bladder. Here we have some residual bladder mucosa. Just beneath the mucosa is the lamina propria. And over here, the lamina propria is very disrupted because of the presence of tumor and ulceration. This is the region of the lamina propria. As we move deeper, here, this thick pink layer is the muscularis propria, and this is composed of bundles of smooth muscle cells. And as we go deeper, this is the perivesical fat, which sometimes is covered by serosal layer in some parts of the bladder, but in many parts of the bladder, it is not covered by serosa. In the parts where it is not covered by serosa, it is known also as the adventitial layer. Let's take a look at the tumor. We can see here that this tumor is composed of sheets of urothelial cells with hyperchromatic, very dark nuclei with high NC ratios or nuclear cytoplasmic ratios. And if we look around, we can see mitotic figures quite readily. So there are frequent mitotic figures. These are all features of high-grade carcinoma. As we move down in this region, this is where we can still see some of the lamina propria, and we can appreciate that there are these sheets of malignant urothelial cells invading into the lamina propria. The lamina propria itself looks abnormal. It has more spindle cells because of a desmoplastic reaction. And we can also see an accompanying inflammatory reaction, including lymphocytes, as well as occasional plasma cells, which are larger. Moving deeper, we continue to see these invasive sheets of malignant cells now invading into the very obvious pink muscle bundles in the muscularis propria. Again, there's a lot of accompanying chronic inflammation. And as we go even deeper, we still see these nests of malignant cells. And now we come to the deep extent of the muscularis propria. So this is where the muscularis propria stops, and here is the perivesical fat. If we draw a line across here, because the muscularis propria is very disrupted by tumor, if we draw a line here, we can see that there is still tumor that goes beyond the muscularis propria into the perivesical fat. On closer look, we can see these sheets of malignant urothelial cells, and they are invading into the perivesical fat. Let's learn a bit more about invasive urothelial carcinoma. Carcinoma of the urinary tract can be divided into non-invasive and invasive carcinoma. The non-invasive carcinomas are called non-invasive papillary urothelial carcinoma. They usually have a papillary configuration, and they can be low or high grade. Invasive urothelial carcinoma invades into the wall of the bladder, and it can be the usual or classical type of urothelial carcinoma. It can also sometimes have squamous or glandular differentiation or have other histological patterns. So invasive urothelial carcinoma is defined as urothelial carcinoma that has invaded through the basement membrane of the urothelium into the underlying lamina propria or deeper. It has a worse prognosis than non-invasive papillary urothelial carcinoma. Here is an example of an interactive virtual pathology specimen showing invasive urothelial carcinoma. This example is taken from Pathweb. This is our free online pathology resource, and our virtual pathology museum has more than 1,000 interactive virtual pathology specimens. Registration is completely free, and the link is in the video description. So here we can see this large fleshy mass that protrudes into the lumen of the bladder. If we look more carefully in this area, this brown line is the muscularis propria. We can see that the tumor is actually infiltrating into the muscularis propria grossly. Here is a diagram taken from the College of American Pathologists' Cancer Reporting Protocols, showing the layers of the bladder wall. So we have the mucosa, the lamina propria. There is a very thin layer of smooth muscle here, and the lamina propria is deep to that. And then we have the very thick muscularis propria layer, and finally the perivesical fat. So this is how we stage invasive urothelial carcinoma in the bladder. This particular case, we can see it actually more clearly under the microscope. And at this low magnification, again, we can see the extent of the muscularis propria here. The tumor just goes below this, beyond the muscularis propria, which corresponds to T3A in this case. So here is our example of invasive urothelial carcinoma, and we can contrast this with non-invasive papillary urothelial carcinoma. You can see here that it has a papillary configuration. It protrudes into the lumen of the bladder like a frond-like mass. The lamina propria is not involved. There is no invasion into the lamina propria. The muscularis propria and the perivesical fat are also not involved. And just to recap the microscopic features of invasive urothelial carcinoma, we have irregular infiltrative nests and sheets of malignant urothelial cells. They invade into the lamina propria or deeper, and usually these will demonstrate high-grade features such as high nuclear cytoplasmic ratios, nuclear pleomorphism, and the presence of frequent mitotic figures. Here is a low magnification picture showing the tumor islands invading into the lamina propria and into the muscularis propria. And here, to recap, is the deep edge of the muscularis propria, and we can see that the tumor has gone beyond this into the perivesical fat. Here again is a higher magnification picture. This is the deep edge of the muscularis propria with the very pink, smooth muscle bundles. Here is the perivesical fat. We can see nests of malignant cells within the perivesical fat. And once again, the prognosis of invasive urothelial carcinoma is worse than that of non-invasive papillary urothelial carcinoma. I would like to invite you to check out Pathweb, which is our free online pathology resource. There are many virtual interactive pathology specimens, and registration is completely free. Again, the link is in the video description. Thank you.